All right, so yesterday I got a DM on Twitter from somebody who was actually a part of a massive study that just dropped detailing how completely broken and dysfunctional our largely privatized and for-profit healthcare system really is in the United States, and specifically relating to our failures surrounding COVID. So I wanted to get into this with you guys because honestly, this is stuff that at surface level would be pretty basic. Obviously, having a universal healthcare system that covers every single person, regardless of how much money they have in their wallet, is going to produce superior medical results than a system that stratifies and rations healthcare based on how much money somebody has. But just to get the details here is really useful in a moment like this to remind ourselves of how desperately we need a Medicare for all single-payer system. So here from Scientific American, they did a write-up of this report saying universal healthcare could have saved more than 330,000 U.S. lives during COVID. And they say Americans spend more on healthcare than any other nation, yet in any given year, the piecemeal nature of the American medical insurance system causes many preventable deaths and unnecessary costs. Not surprisingly, COVID-19 only exacerbated this already dire public health issue, as evidenced by the U.S.'s elevated mortality compared with that of other high-income countries. And they say a new study quantifies the severity of the impact of the pandemic on Americans who did not have access to health insurance. And they say, according to findings published on Monday in Proceedings of the National Academy of Sciences USA, from the pandemic's beginning until mid-March of 2022, universal healthcare could have saved more than 338,000 lives from COVID-19 alone. And the U.S. also could have saved $105.6 billion in healthcare costs associated with hospitalizations from the disease, on top of an estimated $438 billion that could be saved in a non-pandemic year. So think about all of the different talking points that conservatives and liberals come out with against a system like Medicare for All or any universal healthcare system like this. We're always told that, it's going to be way too expensive. How are you going to pay for it? That was the famous question that they relentlessly asked Bernie Sanders over and over and over again. And the reality of the situation is, no matter which country you live in, no matter how you are stratifying your healthcare system, you're always going to have to pay for healthcare as a society. So the question is, do you want to have a privatized for-profit system that requires individual Americans to pay ridiculous sums of money to private health insurers who are profiting off of their disease, profiting by denying them care, and in many cases this results in Americans not seeking care or not being able to get the care that they need without the threat of bankruptcy looming over their head? Or would you rather have a system that does not, commodify our healthcare system and actually just provides it in a universal basis and costs all of us less in the long run, and also obviously produces superior results? This is not a difficult thing to analyze. Obviously, having a for-profit middleman in between you and the doctor that you are trying to go see is not going to have positive results for anybody except for the health insurance executives. And that's exactly, exemplified by data like this. But they say people who do not have insurance usually do not have a primary care doctor, which means they are more likely to suffer from preventable diseases such as type 2 diabetes. They also tend to wait longer to see the doctor when they fall ill. Another interesting talking point that we are constantly hearing in pushback for Medicare for all. You're going to have to be waiting in line. Well, the current status quo is that if you don't have enough money to potentially subject yourself to going into medical debt, or if you don't have enough money to go to a doctor on a regular basis, a primary care physician, then not only are you going to have these added negative health consequences as a result of that, but you're also going to have to wait, and you are going to have to wait infinitely longer than you would under a Medicare for all system because you just don't have the fucking money to pay for this healthcare when you need it. But they say these two factors already contribute to higher mortality rates in non-pandemic years, and they compounded the impacts of COVID-19. They say comorbidities exacerbate the risk of the disease, and waiting to seek care increases the likelihood of transmission to other people. So it's not just the failures of our healthcare system within the context of COVID, it's also everything leading up to COVID, right? We have more of these illnesses that lead people to be more predisposed to get severely ill from COVID because we do not have a functional healthcare system in the first place. We didn't have that before COVID, and so of course we're going to have more people who are going to have more disastrous effects from getting COVID because we don't have that underlying structure that was there in the first place. But they continue saying in the new study, Galvani's team compared the mortality risks of COVID-19 among people with and without insurance, as well as their risks of all other causes of death. And the researchers compiled population characteristics of all uninsured Americans during the pandemic, taking into account things such as age-specific life expectancy and the elevation in mortality associated with a lack of insurance. And they calculated that 131,000 people in total could have been saved from dying from COVID in 2020 alone, and then more than 200,000 additional deaths from COVID-19 could have been averted since then, bringing the total again to 338,000. And finally, they say the researchers also estimated the cost to insure the entire American population and the savings that that measure would produce. In other words, a single-payer system. And they found that a single-payer healthcare system would generate savings in 3 ways. Number 1, more efficient investment in preventative care, lowered administrative costs, and increased in negotiating power for pharmaceuticals, equipments, and fees. And this would ultimately produce a net savings of $459 billion in 2020 and $438 billion in a non-pandemic year, the authors found. I mean, this is like half of our military budget that we are talking about here in savings, because again, you wouldn't have this, as Kyle Kulinski says, mafia-style middleman of a health insurance company that's only goal, only purpose is to serve the interest of their shareholders. And in this case, when you're in the healthcare industry, the way that you do that, the way that you increase your profit margins as a health insurance company is by restricting what you are going to cover for people, restricting the ability of which doctors people can go to, which hospitals they can go to, what type of medicine they can get access to. That's where they make their profits. It is the most perverse incentive structure you could possibly ask for. They have a direct financial incentive to make getting healthcare as expensive and difficult as possible for average Americans. But again, that's why it's no surprise that you would see hundreds of billions of dollars in savings from a system like Medicare for All. But they say Medicare for All would be both an economic stimulus and life-saving transformation of our healthcare system. Galvani says it will cost people far less than the status quo, and obviously will also produce much better benefits. So this is nothing that we didn't already understand at like a fundamental level. Again, obviously not having that middleman that's just price gouging you while you try to get your healthcare, it's going to cost less, and also it's going to produce better outcomes because you would be covered for everything. You wouldn't have some private insurance company that gets to pick and choose which doctors you go to, get to pick and choose which type of treatments that they're going to cover, and then still, even if you do have insurance, leaving you with that threat of potential bankruptcy due to medical bills if your health insurance company just decides that they don't want to cover something. So it's just a completely ridiculous and perverse system that we have here. But this is the corruption that we have in the United States baked into our political system. This is Joe Biden taking thousands and thousands, if not millions of dollars in basically political bribes from these gigantic health insurance companies, and then turning around and saying that Medicare for All is pie in the sky and that it's just not realistic, and not even pushing for the public option, which he ran on in 2020. We haven't heard him say that a single goddamn time since he took office. But just to put it in perspective here in terms of how much money is being made here, they say from the New York Times, major U.S. health insurers report big profits benefiting from the pandemic. So again, I mean, listen, you see the incentive structure that is baked within the capitalist system generally, but also specifically within an industry like healthcare. I think even if you are a capitalist and you don't believe in like decommodifying all of these different sectors within our economy, healthcare is one where I think everybody should agree on this. Unless you literally are working for one of these health insurance companies, you should be able to understand that having a profit system drive what healthcare the American people are going to get is going to produce worse results than having a single payer, government insurance program, which, by the way, doesn't necessarily mean that the government is going to get to pick and choose what they cover, that they're going to pick and choose, which doctors you're going to go to. No, it's much more of a free system, counter to what propagandists who are against Medicare for All would have you believe. You wouldn't be having higher wait times because, again, under our current status quo system, some people just straight up never get to go see the doctor if they can't afford it, if they don't have insurance to back it up. You wouldn't have the longer wait times. You wouldn't have, the risk of bankruptcy hanging over your head if you dare to go out and seek medical care. You would have much less preventable diseases in this country because people, again, will be able to go and consistently see a primary care doctor, take care of issues before they get, worse and worse and worse over time. So many different benefits that would be had from a Medicare for All system in terms of health outcomes. But then on top of that, it's also just a cheaper system. I mean, again, you can fearmonger all that you want and say, oh, how are we going to pay for that? How are we going to pay for that? Well, the reality of the situation is we're already paying for it. The American people are already paying for it. So you, as an average American, would be paying significantly less through any, perceived tax increases as a result of implementing Medicare for All than you are right now in the private market. So, all of these different talking points are just completely thrown out the window when you understand what type of healthcare system would actually be functional in this country. So just another good reminder here, credit to this group for putting this report together. together. It's just a reminder in terms of how completely perverted our healthcare system is here in the United States, and how desperately we need to move away from the profit motive and towards an actual single-payer universal healthcare system here in the United States.